Okay, so it looks like numbers are stabilizing. Actually, they're going up a little bit now, but I think we'll get started anyway. So hello, everyone. My name is Brian Mallon. I'm the Marketing and International Recruitment Manager here at the Faculty of Medicine. So thank you for joining us for this webinar about doing research during your medical degree. So I'll get straight into it. Let me just change my camera view so that you can see all the panel members. Okay, so we're joined by Professor Di Eley. So she'll be giving an overview on how you actually do your research during your medical degree. We're also joined by two medical students, so Chloe Yap and Priya Puri. And then we're also joined by Shalon and Sue Barros. So they'll be in the back end answering questions in the chat. Oh, and as well as Jules. I just saw Jules there. Hi, Jules. Okay, so let's get straight into it. Professor Eley, I'll hand over to you.
Okay, thank you, Brian. I'll just try and share my screen again. So can you see my screen?
Yep, I can see your screen.
See my slides, okay. So hello, everyone. I'm really pleased to be here, and I'm hello in morning or good afternoon or evening, wherever you are. I think there's a scattered bunch amongst us. So I'm talking to you from Brisbane in Australia, where UQ a medical school. I direct the student research in the medical program. So, you know, I'm kind of the go-to person if you've got questions about research, but I'm going to go through some of the highlights that we have, not only in the Faculty of Medicine and at UQ in general, but also in the medical program in terms of what you can do when you're a medical student. So just a little bit about the faculty. The Faculty of Medicine is pretty big. UQ is a big university. I'm sure you've already done your homework on UQ, but in the faculty itself, we've got a lot of undergraduate students, very strong postgraduate students, so a lot of master's degrees and PhDs, as you might imagine, in medicine, and lots of researchers. And also, as with any medical school, we have an army of academic title holders who not only do research, but also contribute to teaching in the medical program. And we're pretty global, 63 countries in terms of the students who are enrolled in various, degrees in the faculty. And we do pretty well with research income. We're very research intense university, which again, you probably have done your homework on UQ and know that. And so you'll be amongst a lot of research students. It's a really rich environment for research. And that's not only for students, but also for connections with world-class research opportunities. And, you know, what do you do in a medical, in a Faculty of Medicine? Our research is about translation. So we've got 3 main programs within the faculty, and they all follow this sort of pipeline of basic to clinical to evidence, and then translating that evidence into healthcare. And we do this by 3 main programs: the biomedical sciences, which are as a medical student, you'll be doing a lot of coursework with biomedical sciences, and then in the medicine program itself, which encompasses all our programs, and then we have a public health program as well. And just as an aside, we also have a Master's of Public Health, which can also be combined with a medical degree at some point in your program. So to support your learning is really quite exciting at UQ. I mean, we have 5 hospital-based research centers, and this is a photo of we call it TRI. It's the Translational Research Institute, and this photo doesn't do it justice because it's an enormous building. For one thing, I think you can see it from the moon, and it's beautiful. And this is just the foyer, very impressive. And it houses, I think, 3 or 4. I think one of our students today is going to talk about her research, which is housed, I think, at NADA Research Institute, which is one of them that's in this building here that we're showing. There's also a Center for Clinical Research, which is based at another campus, another hospital. and health services research, a Child Health Research Center, and the Diamantina Institute, which is another one of the institutes that's housed in this tri-building. As a first year and a second year student, you'll see a lot of this building. And so it's pretty prominent in your program. So as I said before, we've got the schools of biomedical sciences, public health, and then the School of Clinical Medicine really encompasses what you do in Brisbane, in the greater Brisbane area. But there's also a rural clinical school, and there are 4 sites for this. So you can spend some of your program in one of the rural clinical schools, and they're regional or rural Queensland. And then, of course, we have the Ochsner Clinical School, very special, which is housed in New Orleans. So I think some of you may be ready to enter that program as well. So from what I've said before, it's pretty clear that it's pretty comprehensive research that you can do at UQ. And it's all about human health and healthcare. And if you can see this, you probably can get these slides later, but these are the research highlights, just about anything you can think of. But these are the really key research areas that you can get involved in. And I'm going to tell you now the next slide. That's the one. So these are the research opportunities that you can do as a student. And as I've said already, you know, UQ as a really traditional scientific program across the whole university, and it's known for you know, academic excellence as well. And so we encourage you to get involved in research throughout your degree. And these are the 3 main areas or sort of tiers of research that you can get involved in. There's the clinician scientist track, which is actually the MD PhD or an MD master's degree. And you need to be eligible for this, but that's possible if you've already got a strong research background and you've got an area that you really want to pursue more deeply. You might look into the clinician scientist track. For just about anybody, you can dabble into work experience research with extracurricular research. There's some eligibility for all of these, but you know, these this extracurricular research option is probably most popular among students, especially if you haven't got a lot of research experience to give it a try. And then there's some coursework options in the curriculum in terms of research, and there's 2 research electives that you can do in as well to a semester of research as an elective. Now, I have to stress that if you're interested in anything with research, you should go to this website. This is really, you know, the source of information about what you can do in terms of research in your medical degree. And basically, it does what it says on the tin right here. It connects students with supervisors. So this is the homepage of the research portal, and I, you know, encourage you to have a look at it and look around. There's this is the page here for the clinician scientist track, and this is a special Ochsner student research hub, which you might look at if you're an Ochsner student, incoming Ochsner student. And basically for extracurricular research, you might want to look at 4 students and 4 researchers. This is all a bit early, but you know, do have a look and see what's available to you. And also on the portal, there's information about student events, a whole page on student achievements. So when you get a paper or publication, you know, you let me know, and you know, it's posted. We really want to note the achievements of our students. We're very proud of our students in their research and what they do. And as I said, they've got the opportunity to do some wonderful research here. So we really want to know about it and really, you know, advertise it, your achievements. If you're interested in the MPH, that you could look here. And then, you know, there's other things, scholarship opportunities, and other things like symposiums that you can use, that you can be involved in. And we've actually got, this is an old slide, this says 2021, but the Medical Student Research Conference is in 2 weeks' time. So when you get here, you'll have to start participating in that. And then these, I encourage you to look at this. I haven't got internet connected here, but you can look at the clinician scientists that we have in that program. There's a list of them with their photos. So that's always nice to have a look at as well. So just really briefly, as I say, we like to know what you're doing in research, and we keep track of it, and we really try to applaud your achievements. And this is the sort of the breakdown of projects, and this is just from 2018 to 2020, so it's a little bit out of date, but we have domestic cohort, international, and the Oshner cohort, and these are the sort of research that has been that they have registered with us and they're active with. And then in terms of achievements, publications, and awards, the same thing. We like to know what you're doing and celebrate it with you. And so just to sort of wrap up, again, I'd like to also say that there's a lot to get involved in, not just in the medical program, but if you keep your eye on the portal, we also advertise other research events that you could be getting getting involved in, not just in participating, but also helping to organize. This is a really good way to meet your idols, I guess, some really important researchers and their talks or programs that they put on, and really get involved while you're here. And then, as I said, we in medical school have a conference ourselves. We're also we're lucky to have good support from the Australian Academy of Health and Medical Sciences. And you can get involved in this as a student as well. And then Research Day at Oshner, I'll have to give a plug on that. That's a very important and prestigious day of research and students can also be involved in that. And I think that's my last slide. So that's my details there, and I'll be very happy to answer questions from anyone and welcome you to Brisbane when you get here.
Great, thank you very much, Professor Eley. I think there's already a few questions in the chat for you, but we'll get to that after the student presentations. So I guess we've heard about how to get involved in research, but now I want to hand it over to the two medical students who are actually doing it so that they can talk about their experience. So firstly, I'll hand over to Chloe Yap. Over to you, Chloe.
Hi there, everyone. Thanks for the introduction, Brian, and for having me on. So, as I mentioned, my name is Chloe. I'm an MD PhD student at UQ. So I've done 3 years of medicine, have taken 2 years off my PhD. I'm in the second year of that. And then next year, I will go back and finish my final year of medical school. And so my PhD is at Marta Research Institute, which is within that beautiful orange building that is the TRI, and it's also split across the Institute for Molecular Bioscience, which is a more basic fundamental science research. I'm actually currently in Los Angeles as a visiting student, so feel free to reach out if you're around the area. So I've been asked to talk about quickly my journey into medicine. I guess my route was a bit different, and you'll see people around when you get to Australia who were in this position, but there's kind of an undergraduate route out of high school where you sort of get a provisional entry and then you sort of roll into medicine at the end of that. And I mean, I guess I was very naive. I'll be the first to admit that when I first thought about medicine. But I mean, I guess by naive, I mean that the medicine that I imagined is very different from the medicine that is the reality. But I think the fundamental idea of enjoying science and interactions with people still holds. And so I guess that's how I got into medicine. I fell into research in a much more serendipitous way. It just so happened that there's a summer research program at UQ. I reached out as a first year undergrad and just loved it, just really, really loved it, and have been with that group ever since, in fact. And I think there's a case to be made there about the combination of serendipity, which you can't control, but also putting yourself out there, which you can control. And I think many things in medicine seem pretty cut and dried. Like you kind of just get in, you get on the track, you apply, you compete for a position potentially, and then it's pretty linear. But I think if you want to do anything kind of outside that linear process, there is a lot of serendipity plus putting yourself out there that becomes involved. In terms of the research that I do, I think the fundamental questions that I'm interested in is understanding the biological basis of psychiatric conditions. We don't know much about psychiatry in general. We haven't for centuries, and that hasn't changed that much, although it is changing now. But without a deep understanding, diagnosis and management will continue to be really messy and difficult. So kind of the first question I'm interested in. The second question that I'm kind of interested in is this relationship between mind and body, which kind of sounds like a new age sort of pseudoscience thing, but there is actually a lot to it. And there's a famous saying, which you also encounter, I think, quite a lot when you start phase one, is that there is no health without mental health, and both need to be improved together. And so my research is looking at these questions specifically in the context of autism, which is a neurodevelopmental condition. And I know it probably sounds like I've got things relatively figured out, but in reality, it was an incredibly windy path, and sort of retrospectively sort of finding that it worked in the end. And I think that's the case for a lot of people who take an interest in research, to be honest. Another point I've been asked to talk about is why it's important to bridge the gap between clinicians and scientists. And I'm very passionate about this. And the fundamental reason why I'm passionate about that is because it's motivated by a need to do better by our patients. And I know we're often motivated to do research for other reasons, like getting into competitive specialties, and that makes full sense. But I think it's just really important to not lose sight of the real reason why research is put on the agenda in the first instance, because we need to do better by our patients. I think it's been pretty obvious in the case of COVID. Over the past 18 months, we've seen basic science really rapidly translated into real world impact. But I think on top of that, every kind of advance we have in medicine at the moment, every new drug on the market, the reason why people now have better outcomes after a heart attack, that all comes from research, that all comes from science. And we can all engage in that, I think, as future doctors. I think also as well, there's just so much we don't know in medicine yet, and we've got to be comfortable with that and acknowledge that. It might not seem that way at the moment. It seems like, when you talk to an attending or a consultant, they seem to have it all figured out, but medicine's actually really messy. And for some really common conditions, outcomes haven't improved in decades. So I guess that's another reason why to do research. And in fact, there are actually some instances in which we've taken medical dogma as dogma, and even when it doesn't have good support, and in some cases that has actually harmed patients, they've looked back. So I think, the first step to do better for our patients is to ask these questions and challenge what we assume we know, what we assume we know. I think every doctor needs to do that, regardless of whether you identify as a scientist or not. For example, we all have guidelines in medicine, but it's really important to know how those guidelines were formed, because if the guidelines weren't formed using evidence that applies to your patient sitting in front of you, then you've got to kind of reconsider about how kind of much that applies, and then how you actually treat them. And so I think that's what every doctor needs to do. There's kind of another step further from that, which is more involved, and not everyone would get into it, but then that would be to actually tackle those questions, to ask hypotheses and test them for yourselves. So I think, to sum that up, many of these activities that are necessary to improve care are also core to being a scientist, and it's a scientific method that you're applying as well, which is why I think it's important for every clinician to have some understanding of research and science at whatever level that is. I've also been asked to talk, I guess, about the breadth and quality of research at UQ. I think Di's covered most of that already, but I would also just also vouch that UQ really is a research powerhouse in Australia. There's many areas of excellence and world leading work. It's almost like name a field, name an area, and there's probably someone working on it at a high level. There's a lot of specialized research institutes. Doesn't matter if it's basic science, public health, clinical research, translational research, qualitative or quantitative research, or anything in between. There's a lot going on at UQ. You just need to kind of know where to look. And I guess that segues pretty nicely into what advice I would give for medical students who are interested in research. My first point, as I mentioned before, is kind of recognizing that combination of serendipity and putting yourself out there. Don't be scared to send the email. You know, what's the worst thing that could happen if you ask? I mean, they just don't reply. Like, that's the worst thing that could happen. In terms of where to look, I think a lot of people ask that. As Di mentioned, the student research portal is an excellent best place to start. Sometimes as well, after a lecturer kind of presents, they might mention some things or projects, and then it's always a good idea if you're interested to go up and talk some more, and maybe you might get a project for that. And other than that, just be a Google stalker. Just, you know, look around, do your research. Another piece of advice is to consider when you're choosing a project, there's like people, you know, the people you'll be working with, and then the project, and both are important. You want to make sure that you gel with the people, and you want to make sure that the project interests you. If you're doing a longer term project like a PhD, the people is probably a bit more important than the project, but you want to consider both of those up when you're making a decision. I would also recommend trying a variety of things out, because sometimes it takes a while before, you know, you find something that really clicks for you, whether that's people or project or both. But having said that, the caveat is to don't overpromise yourself. And when you commit to a project, commit and sign up, turn up, immerse yourself and be a finisher. No one wants to see someone sort of drop off the face of the earth. That's just really difficult and kind of burns bridges, which no one really wants. So I think my time is up, and so I think I'll leave that there.
Great, thank you, Chloe. Before I head over to Priya, I just had a question, for you to talk about the 3MT and what that experience was like for you, and maybe just give the audience a bit of a background about 3MT and why we actually host it.
Oh, for sure. So the 3MT, which stands for 3-minute thesis, was this sort of science communication program and competition that came out of UQ. And I guess the explanation sort of is in the title. So you try and explain your thesis or your research project within 3 minutes. And so I think that's a great way to sort of crystallize what you're doing. I think when you do research, you kind of, go down a rabbit hole and all these incredibly precise details. But doing a 3MT allows you to step back and, look at the big picture and communicate it, to everyone, which I think is an incredibly valuable experience and skill to have.
Great, thank you. And if anyone wants to watch Chloe's 3MT, just Google Chloe Yap 3MT UQ and the video will come up. Okay, so now we're going to head over to Priya, who is a UQ Oshner student currently in New Orleans doing her phase 2 of the program. Over to you, Priya.
Thanks, Brian. Hi, everyone. My name is Priya. My research experience is definitely not as extensive as Chloe's, but I can tell you a little bit about myself and my experience with research, what I love about it, how I'm trying to integrate it in medicine. So I grew up mostly in Arizona and North Carolina. My mom is a cancer immunologist and she has her own lab and does a lot of cool research. So I've been exposed to research my whole life. When I was younger, I wasn't really interested in, basic science and wet lab research as much. But when I got my undergraduate degree at the University of Pennsylvania, where I studied public health. And that's when I really got into clinical research and understood its importance and really enjoyed it. I worked with a pancreatic cancer surgeon, did research with him, and also got the opportunity to go to Botswana and do cervical cancer research there, where I talked to women in the community and tried to understand barriers in their care in cervical cancer screening and also treatment delays. That's what really ignited my passion for global health, which is why I chose the UQ Ochsner program as for medical school. I really just wanted to get that global experience and enjoy the best of both worlds. During my time in Brisbane, I actually decided not to do research for the first 2 years because I wanted to focus more on studying for USMLE Step 1. But because I had a lot of prior research experience, I applied for the Ochsner Medical Student Association research rep, so I could help my peers, get connected with research opportunities. And I worked with Dr. Eley on ways to help connect students. Because as Chloe said, it can be daunting at first, and putting yourself out there is really important, but it's also really hard. So there's a lot of support at UQ, not only faculty, but also peers and various UQ Medical Association representatives to help you out with getting involved in research if you choose to do that. Now that I've started my clinical years, I found it's pretty easy to get involved in even small projects along the way. If you see an interesting patient, you can always talk to your attending or resident to work on a case report. And those are some easy ways to get publications under your belt. You can also work on some bigger projects. Right now I'm working on a couple different projects. One of them is a surgical oncology project, which is I'm helping create a pancreatic cancer database to kind of look at trends and see what publications we can get out of that. I really enjoy that because I used to do pancreatic cancer work, so it's nice to come around full circle and work on that. There's also such a need for pancreatic cancer research. We need a lot more information about this disease. Another project I'm currently working on is looking at maternal outcomes after COVID infection in vaccinated versus unvaccinated pregnant patients. That's a really new and relevant one that we just submitted for publication. So there are plenty of opportunities both at UQ and also at Ochsner. All the faculty is very willing to get students involved, put you on publications, which is nice. And yeah, just to piggyback on what Chloe said, I've noticed that what I really enjoy about research is how it helps your patients ultimately. Whenever you're in a field, whether it's OBGYN or surgery, you have so many questions, hypotheses, maybe you see some trends, maybe there's debates amongst different practitioners and you want to know if this correlates with that. And by investigating these things, you can really influence patient care for the better. You can educate your peers, create guidelines. So yeah, I think it's a really incredible way to improve patient care and really help your patients, which is why I want to stay involved in research. And I think everyone, all medical students and doctors should just stay curious. Yeah.
Great, thank you very much. So that's the end of the formal presentations. So we'll open it up to questions. So there are already a few questions in the chat. Professor Eley, I guess I'll send you the first question. So basically it's asking about tuition fee there's two parts to the question. So kind of the extra tuition fee as well as how competitive is it to get onto these programs?
Okay, thanks, Brian. And thanks for whoever asked the question. It's a good question because you will be an international student. And international students do have other fees than domestic students. It's I think this is the case everywhere. So there's really, I'll take it in two parts. If you're eligible, because you do need to be eligible to get into the clinician scientist track, which is a MD, PhD, or an MD master's. If you're eligible for that and to get into that program, that's a separate degree. So you will, as an international student, presumably have to pay fees. But one thing I do is I make sure that if you're going to apply for that program, that you will get a scholarship. So there are scholarships available that will pay your PhD tuition and a PhD living stipend. It does not do anything with your medical. Your medical degree is separate. That tuition is separate. But if you were to get onto the clinician scientist track, you have to get a scholarship. So that's part of what I would do. I could talk to you, and we would meet and discuss your background, where you want to do your PhD, and there is a whole application process for it. So I would advise you, if you're interested in that, let me know. You can send me an email, or you can seek me out at orientation, but early in your first year, let's talk and see what first thing I'd probably do is ask for your CV to see if, see what your background is. Because as I said, to do a MD, PhD, you have to be, you're already in the MD, but you have to also be eligible to do a PhD. And so that's what we would be talking about. Hope that answers your question. Oh, it didn't finish. Sorry. So if you're not doing a PhD, no, there's no cost to doing extracurricular research. And obviously, if you do choose to do one of the electives for your research, that's coursework. So there's obviously no cost involved there. Very important with the extracurricular research. So this is known as unpaid work experience. So it's another word for volunteering is what it is, but it is a really good way, as Priya said, to get involved in even small projects and make a difference. And sometimes, as Chloe also said, you try things and then you get to know the people and the type of research it is, and you need to stick with it a bit, try it for a while, definitely love the commit and finish. That's, that is paramount to everything you do. You can't, and especially in research, research is a partnership. You never do research on your own. As a student, you're being, it really is a privilege for you to be involved in someone's research and for you to be part of that and learn from it. And, hopefully, researchers are very generous. If you do your bit, you will, you'll probably get on a paper or in an abstract, do a presentation, who knows. But, you do, my advice, at first years, take it slow, look around, try a few things, but, that is free. You don't have to pay for that.
Thank you, Professor Eley. I think you've answered a few of the questions in the chat. I guess adding on to that, are students who haven't actually started the medical program allowed to contact you or a professor before their first day to talk about research opportunities?
Well, you can certainly contact me. I'm happy to do that. But, and Chloe mentioned this, sending an email is what's the worst that can happen. And, they may not answer, but, this is your opportunity to do some research of your own and really think about, why am I asking this question? Don't just go fishing. Don't send these blanket emails. I'm interested in this. Tell me more about what you do. Turn it around and say, I've heard about what you do, and I'm really interested in this, this, and this. Everybody's, nobody can hide nowadays. You can look them up. If you look at the portal, there's a page that has direct links to all the UQ research centers and institutes. Have a look at those, start browsing and see what you're interested, where you go. And if you're don't know what you're interested in, this is the best way to do it. But don't just do a shotgun approach where you just, you spam everybody. Nobody's going to take you very seriously with that. Take your time and think about what you might want to do, and do a little bit of research on them, you know, flatter them. Say, I really liked your last paper, or I understand you do, you know, research, or when you get, I heard your lecture, or you know, and, you know, definitely like Chloe's advice too about, you know, going up and say, you know, thank you for your lecture. I'm really interested in a lot of students get projects that way. Hope that answers your question.
Thank you, Professor Eley. I'll stay with you for one more question, if that's all right. So a incoming student has asked if they can publish a paper that they're currently working on under a new affiliation of UQ, or do they recommend us to publish the paper under a previous affiliation? So I guess that's a research done at their current institute.
Yeah. Well, that's a really good question, and congratulations on getting a paper. And actually, you know, it's up to you. Once you're enrolled in at UQ, and if you've done that research at UQ, you're kind of obliged to use that as your affiliation. However, you can use as many affiliations as you want. So in your case, if you're still finishing a paper when you get to UQ, maybe you're still writing it and everything, you're free to put on both affiliations. And I mean, I would certainly expect you to put on the affiliation with who you did the work with and when you started. That would be expected. But if you wanted to add on UQ, that's all right as well once you're enrolled as a student.
Great, thank you. That's all the questions I have for you at the moment. Chloe, over to you. So Holly has a question about other research opportunities in the area of movement and health research at UQ. Do you know of any other opportunities at UQ?
Movement and health, I'm not so familiar with that department. That's probably more in sort of HAB, so health, and that sort of health faculty. There's definitely a lot of physio research by physiotherapists and kind of exercise physiologists and kind of within the School of Biomedical Science. But I can't personally comment just because that's not really my field. But as I mentioned, definitely worth just give it a Google, and I'm 99% sure that you will find someone.
Great, thank you, Chloe. And I've got another question for you. Someone's asking about why you're in California as a visiting student. Can you talk a bit more about how you ended up over there?
Oh, sure. So I got a Fulbright scholarship to come across. So that was a case of, I mean, my supervisors sort of mentioned, oh, you know, if you're doing a PhD, you may as well spend some time overseas as well. So they kind of, you know, suggested some people to work with at UCLA, and then sort of teed that up, and then also kind of got the funding myself through the scholarship program. So, I mean, you know, if you do a PhD, those options are very much open, obviously depending on your supervisor, you know, what works and that sort of thing. But I'm sure both supervisors would be more than happy to let, you know, people explore what they want to do. That's kind of just how academia is in my experience. Yeah, so that's sort of how I got here. Hopefully I can get back.
Great, thank you. Priya, over to you. So there has been a comment in the chat about doing research to make yourself more competitive to, I guess, match into specialties. What advice would you give to current medical students about doing research just to make themselves competitive?
Yeah, thanks for the question. I think there are definitely specialties where you do have to do that. But if you're just doing it for the application or to apply to certain specialties, they don't really look at your research. The match usually doesn't look at your research unless it's a very like research heavy program that you're applying into. A lot of the programs in the South aren't as research focused, but again, for competitive specialties, yes, they do like to see some publications, but even case reports, small abstracts are okay for that. My advice personally is always do something you're interested in and passionate about, because it just makes it easier on you. You know, you won't dread doing it. You only have so much time when you're on clinical rotations. You're in the hospital a lot, and if you have to study for STEP, and if you are trying to do research you're not interested in, it's just going to be a burden, and you're not going to enjoy it. You're not going to learn that much from it. So yeah, try to get publications for these competitive specialties, but also try to focus on things that you are interested in, and always talk to your residents when you're rotating, because they can help you with opportunities or anything that they're working on. They just need people to write. You can always get on those too.
Great, thank you. Professor Eley, question for you. So in the current environment where the borders are closed and students can't get to Australia, so I guess this year we've had a lot of our first years online. How can students get involved in research if they're still online? Fingers crossed next year that everyone will be able to get into Australia pretty soon, but if not, what opportunities do they have?
Well, thanks for the question. It's another good one, and one on a lot of people's minds. I do get a lot of questions from students who are overseas and meant to be in Brisbane, they can't get there. It's frustrating. And there are things that you can do. You can't. I wouldn't suggest you try to start a project, and I doubt any supervisor would even attempt that. But you can do things like lit reviews, or look at data and that. And that might sound very simple to you, because you can communicate with a potential supervisor by Zoom and that. But it can work. I mean, if you have some experience, and you don't need a lot of supervision for something like that, and you'll know that, then that might be possible. And I would encourage you to you can look at the portal and see there's a lot of projects that are advertised as lit reviews. Or you can find one yourself by, looking at some of the, as I said before, just introducing yourself and seeing what they have. But do keep in mind that if you don't already know how to do that, the supervisors, they're busy people. Everybody's busy. A lot of them are not all pure researchers. So they're clinician scientists. So their time is divided. And you have to realize that the extra time that they're going to need to spend with you, and it would be online, to help you through this process is not always beneficial to either of you. So just keep that in mind if you do get a few sort of declines to your offers. I would suggest that if you do have experience, let them know. Give them, say, I've got a lot of experience. I've written this and that, and maybe put some of your work up. That would help a lot. But it's hard for everybody, and it is frustrating. Everybody wants to help each other out, but there are other considerations, that you need to keep in mind. But certainly, carefully decide who you might want to talk to, and if you've got some experience, I'd take you on. You just have to think of both sides of the situation.
Great, thank you, Professor Eley. Just staying with you, can you talk a little bit more about scholarships that are available?
Sure. Scholarships would that be for research only scholarships? Yeah, probably.
The question was associated with the MD, MPhil clinician scientist track.
Yeah. So there is a scholarship. As I said, if you were to get into this, you would get a scholarship because you need to do that. So that's the graduate school scholarship, which is just the standard living stipend, and for internationals, you also get your PhD or MPhil position tuition paid as well. But otherwise, Chloe just talked about getting a Fulbright scholarship. You have to. I guess there's a lot of scholarships out there. They don't come to you and just give you a list. unfortunately. You do have to do a little bit of looking yourself, and there are scholarships for certain areas of research, certain clinical disciplines and things like that. Again, really good advice from Priya to think about what you're interested in. And that's going to help a lot, because there's so much information out there, and it just comes to you. You need to hone in onto something that you're interested in. That makes it so much easier. And as she said, it's going to get you through it, and also lead to other things. So there are main scholarship pages on the UQ website, and that's under the graduate school, because there would be for higher degrees like a PhD. There are also scholarships and prizes in the medical program, and these are also advertised on the the Faculty of Medicine website. And you need to keep an eye on those, because there's a lot of them out there. They're quite often they're very specific, but they do have some that are specific to research. And you don't have to be an MD, a PhD or a master's student. There are some just for research, along with your medical degree. So I guess there is a lot out there, but it kind of depends on what you're interested in, and that will make it a lot easier for you to search for what's there. The portal also, if there's any sort of specific scholarships for students, and this is both clinical and research, they might be on the portal as well. I try to keep that updated.
Great, thank you. Chloe, a question for you. So it's really talking about research experience and how much experience should you have if you wanted to an MD, MPhil, or PhD. What would you recommend? Would it be helpful having research experience before tackling something like this?
I definitely would. I guess there's one question. I think it's sort of two questions, right? Like there's one question about eligibility, which just to kind of get onto the MPhil PhD program, which Di's probably better off. I mean, Di would have a much better feel for that. But I think my personal perspective would be it definitely makes it a lot easier. So, I mean, the way that these intercalated programs are structured is that you take a few years off your medical studies, and that isn't a lot of time. And if you don't have a lot of experience in that field beforehand, that can sort of really eat into the time. My understanding is that like the PhD intercalated time's now being extended to 3 years, whereas for me, when I was kind of going through it, it's 2. And I think, for example, if you're only taking 2 years off for a PhD, that's normally 3 to 4 years, and for full-time work. And if you don't have a lot of experience in that field beforehand, then I think it's difficult. I suppose now that it's a bit longer, maybe it's a bit more possible as well. I guess it just depends how quick you are at picking things up, how independent you are as a learner, and how enthusiastic you are. I think that's a massive modifier as well. If you're not enthusiastic, you're not going to want to pick things up quickly. So yeah, that's my feel. I would be cautious launching into definitely cautious launching into a PhD without background research. The master's bar is perhaps a bit lower. I mean, depending on how that goes. Some is definitely good, I guess, is what I'm getting at. But there is some individual variability there, of course, as well. But I might let Di talk about the eligibility from the graduate school's perspective, though.
Thanks. I will jump in here really quickly, Brian, if it's all right. What Chloe says is true. A lot of that will be decided by your supervisor, because they will not take you on for a project. They'll know more about what the project is that you're doing, and they will, you'll get to know them before you start. And as I was saying before, you need to have a certain amount of understanding or basic. You don't need to have the research experience in that area, but you need to have some basic research experience. And I think I saw something on the chat. Someone asked about an honors year. Now, that's very common to have as a ticket to get into a PhD if you get first class honors. Now, not all schools in the United States have a research honor. So this is what we're talking about. But what I'm mentioning it for is it just shows you have some idea of the research process and how to do research and what's involved. But you don't need to have in-depth experience in the area that you want to go into, because that's what you're going to do the research on. So yeah, as Chloe said, it's for your confidence and also to give you a better idea of what you want to do. You want to do lab research? Do I want to do qualitative research? Do I do, clinical research? Get some experience.
Great, thank you. Good advice. Priya, a question for you. So you mentioned earlier that you didn't do too much research while you were here in Brisbane, but there are Oshner students who do. Do you know any that have, and how they have transitioned from Brisbane to New Orleans and kept that research project going?
Sure. I know a lot of people who did do research while they were at UQ. I would say a lot of them, kind of concluded their projects while they were there, but some, I think it was Nick. I think he did collaborate with orthopedic surgeons at UQ and at Oshner, and worked with both while he was there and while he's here still. So, if you put in the effort and find people to make those connections, you can always do that. And the student research portal will have all information of current research projects at Oshner. And maybe towards the end of your second year, you can start contacting people, if you have an idea of what type of research you want to do to just hit the ground running when you get here. I know people who did do that as well. Yeah, so there's always ways to, bridge the two, go back and do things, or, do a kind of collaboration. Right now, actually, I'm working with the radiation oncologist I worked for in Botswana with that cervical cancer research, doing another project with her remotely on the effects of COVID over there. So whether it's UQ or whether it's your previous institution, I think you can always bridge your research and, keep it going.
Great, thank you very much. So we're nearly out of time. So there are a couple of questions. Someone's from Canada and they asking whether they should apply through Austrec or directly to UQ. So you can do both. Austrec are a great agency and they will be able to give you very good advice, but you can also apply directly to UQ. There is another question about incoming students arriving in Australia before semester one. So I think it's the 12th of October, we're going to be hosting our first town hall for all incoming international students. So an invitation for that will be going out in probably next week, and we'll be highlighting all your options and what semester one is going to look like. So just hold on for that town hall. It's another good question for the town hall. So I might go around the panel for final comments. Chloe, should I start with you? What final comments do you have for incoming medical students who are interested in research?
Oh, it's a tricky one. I think it would be some sort of combination of give it a go, keep the reason why you are doing research in mind. I mean, sometimes you kind of get lost and you get, lost in the technicalities, but, why are you doing the research? What motivates you about it? Do what you enjoy and be a finisher. I think that's really important.
Great, thank you. Over to you, Priya. Advice for incoming medical students.
Sure. I would say when I started medical school, I really wanted to, keep up with my research I was doing before. I really wanted to put in that same time, but you can't. So I would say be realistic with your goals. I was doing research full-time before medical school, and I had my own project. I started from the IRB, like start to finish, and it took a year or two. And you won't have that type of time in medical school. If you do an MD, PhD and, have those set 2 to 3 years to do that, that's different. But while you're in medical school, I would say, be realistic, and do what you can, focus on your studies. But yeah, stay curious about things you're learning, and whatever you're interested in, stay curious and try to find projects around that.
Thank you very much. Professor Eley, lucky last. Final comments for incoming med students.
I don't need to say much because Chloe and Priya have said it all. I mean, really good advice, and I really wouldn't add too much, but take your time, especially first year. Think a lot about what you want to do. You're going to have so much on your plate, but don't, definitely make research work for you. Don't feel you have to do research, or you have to do research while you're a medical student. It will, as they say, make you a better doctor. You hear that a lot, and it will. There's research skills that you're not going to get when, there are skills in research you won't get as just a medical student. So those are really good to have, but don't feel pressured that you have to get them at any certain time. You will get them. And really, as Priya says, be curious. Keep that motivation up there, but take your time. Don't rush into things. And definitely, I love Chloe's, be a finisher. That's part of, sticking with it. And, you might actually find that you do like it in the end. So if you hadn't finished it, you wouldn't know. That's true of everything, not just research. I'm just on my soapbox a bit. But anyway, welcome you when you come, and I'm very glad to hear from you if you have any questions or you want to discuss things. So I look forward to seeing you soon, I hope. Borders.
Yeah, we all hope. And yes, again, I encourage you all to join the town hall in a few weeks. Let me change my view so you can see the panel. So thank you very much, panelists, for all your information and your time today. Thank you, Shalon, for helping out in the chat, and Sue and Jules for joining as well. So enjoy the rest of your morning or evening, depending on where you are. Thank you very much, guys. Bye.